Access to quality healthcare in South Africa comes at an already exorbitant cost, and now even more so with private medical aid health giants increasing their 2017 premiums. And these increases are going to be well over the inflation rate. Now, one of the biggest schemes in the country is Discovery Health, and they recently announced that members should expect a double-digit increase of at least 10% on contributions for next year. To explain the reasons behind the burgeoning costs, I am joined by Discovery Health CEO, Dr. Jonathan Broomberg. Thanks very much, Doctor.
Thanks for having me, Tim.
For joining us here on the program, and we appreciate it.
Thanks for having me.
Now, healthcare is already expensive in South Africa, and we know the minister has said we need a national health insurance plan to cover all. But that private healthcare caters for only a small minority of people. What are the drivers of costs in the private healthcare sector as matters stand?
Tim, I think the first point to make is that this is not a South African problem, or actually even a private sector problem. Medical inflation going up faster than CPI is a global issue, and there are many factors driving it. Let me give you a few. The main issue is that the claims coming into medical aids in South Africa at the moment are much higher than last year and the year before. One of the reasons for that is that people are getting older, so the medical schemes are not growing, and their members are getting older, and when you get older, you claim more. Secondly, there's a rising tide of chronic disease, diabetes, cancer, heart disease, because of the way people eat and lack of exercise. And the average member who has one chronic condition claims 4 times more than a healthy member. So that's the second reason. A third big factor that's more unique to our environment is there has been a large number of new private hospitals opening over the last few years. In fact, about 23 hospitals, new private hospitals in the last 8 years, and those cause a significant increase in admissions to private hospitals. The final point is that there are a large number of new drugs for cancer, for other kinds of conditions arriving in our country, and they are often very, very expensive. And because members of medical aid schemes want them covered, the claims come in and the medical aid pays. So if you add all of that up together, you get the fact that claims are rising about 4 or 5% more than inflation, and that's why the premiums have to go up to cover the cost.
Yes, several points that you have raised, right? And they can stand on their own, each one of them, if one were to probe them one by one. Now, the point of chronic diseases, non-communicable chronic diseases that are escalating, why is that? Why is the private sector not working with the public sector to educate the public and reduce the onset of such conditions? Because I suppose the key thing here would be more that than anything else, isn't it?
Definitely, and you ask a very good question. Firstly, I think the public sector, led by the minister, is doing a huge amount. And, our minister has made, quite a lot of enemies in the alcohol industry, now in the sugar industry, by taking very, I think...
and sorry, just interrupting you, do you think he's on the right course?
I do, yeah. I think that, that laws can certainly help. The government also does a lot about educating the population. If you look at Discovery, our Vitality program is a world leader in trying to use incentives to change people's behavior. And we do work very closely with local government, provincial and national government on all of these. So I think this is an area where the public and private sectors are actually collaborating quite well.
Now, you also mentioned that those living with such diseases claim 4 times more than the average member, which means then from the health insurance point of view, the other members subsidize those with chronic diseases.
Correct. That is exactly right. By law in our country, a medical aid cannot charge less to a healthy member and more to a sick member. There's a law that requires that there's no discrimination between the healthy and the sick. So on one hand, that's a very good thing, because what your medical aid does is you do pay in more when you're healthy, but if something happens in your family and someone gets sick, your family is going to claim a lot more than you pay. So it's a kind of sharing of risk between the healthy and the sick. Of course, it does get more tricky when a person who's sick because of some behavior that they could control. For example, smoking, or how much exercise they do and don't do. So we have to find mechanisms other than the premiums in order to encourage people to be healthy.
Well, you're a doctor. Let me take advantage of your being with me here, right, and talk some medical or health issues with you.
Sure.
Why would exercise or otherwise be a factor here? Why does it matter? Somebody is watching and say, hey, tell that doctor of yours to just cool it for a moment.
So what science is showing, Tim, and is now just a huge amount of evidence that exercise is the most superb medicine for every part of life. It makes people feel better. It deals with depression. It helps people lose weight. It keeps your brain younger for longer. You actually eat better when you're exercising, and it keeps chronic disease at bay. You know, I think our bodies evolved from the African savanna 10, 20, 100,000 years ago. And our bodies are still built for that time when we were running around hunting wild animals. Meanwhile, life's got easy, food is everywhere, and we eat now, and we much more than we did at that time, but our bodies still need the exercise. So there is no doubt that if people could get 30 minutes of exercise 4 or 5 days a week, even just a brisk walk, you can change your life. And those who start doing it become the biggest advocates and ambassadors for exercise.
Another point that you raised earlier on is that of the increasing number of hospitals, right? Now, I'm listening to you and wondering, is it because the number of people who join medical aid schemes are increasing at that rate that leads to 23 additional hospitals being built and established in 8 years? Or where is the demand for such hospitals coming from?
So again, you're asking an excellent question. And over that time, there has been some growth in the medical aid population, driven mainly by the government employees medical scheme. But that growth slowed down about 2 or 3 years ago. And at the moment, the population in the schemes is quite flat. About 17% of our country's population, about 9 million people. So that growth of hospitals has not been because the demand is growing. It's been because the government decided to start issuing licenses, particularly in some of the provinces. Entrepreneurs build the hospitals. And healthcare is quite a fascinating industry because when you build a hospital, somehow it fills up. Because the doctors who are working there are sometimes shareholders in those new hospitals. Even if there's subtle pressure on the doctors to admit more patients. And so I'll give you an example. Around the Umhlanga Ridge area, about 5 years ago, there was one private hospital there. It was already at that time about 14% above the national average in the number of admissions. Then a new hospital was opened. It went up to 20% above the national average. And 2 years ago, a third hospital, Gateway, was opened there. And now the admissions in that area are 30% higher than the national average, but there's been no change in the medical aid population there, not in the numbers or in the disease. So there's more hospital beds being used because there's more hospital beds being built. And that is driving a lot of this inflation.
Well, explain the relationship between the medical aid schemes and the service providers in the value chain. And of course, I'm asking this question against the backdrop of the market inquiry that is currently taking place. What's going on there?
So, the contract that a member has is with their medical scheme, and what the member expects is when I'm sick, I pay my premiums. When I'm sick, I need to be able to get the care I need. And particularly in relation to hospitals, let's take them as a service provider. The members of the medical aid expect that their hospital bill will be paid. So the medical scheme administrator, that's Discovery Health in this case, our job is to go and sign contracts with the service providers. We negotiate the lowest possible fees that we can. Increasingly now we also look at the quality of care that is provided. And then we say to our members, if you're on our comprehensive plan, you can go to any hospital in the country. It will be covered in full. If you're on a lower plan, for example, a Delta or Key Care plan, there's a network of hospitals that you can go to. So we exercise the bargaining power of our millions of members, and we use smart data analytics and others to negotiate the best possible price with the hospitals.
Now, the increases that you are going to implement in 2017, are they avoidable? Is there anything that could have been done to at least keep them to within inflation range?
Yeah. So no, I think, Tim, the first point to make is that out of all the open medical schemes in the country, Discovery Health medical schemes increases next year are definitely going to be the lowest by quite a long way. Already 3 or 4 of the big other schemes have announced their increases, and you mentioned that Discovery Health medical schemes are about 10%, Bonitas is 12%, Momentum is 11%, some of the others are going to be even higher. So ours Discovery Health medical schemes are the lowest. I'm not saying they're low, they're still 4% above inflation, which is 6%. And the short answer to your question is it's not avoidable. A medical scheme, many people don't know, is a not-for-profit entity. It's owned by the members, by you and me and the other members of the medical aid. And every year, the premiums have to be enough to cover all the claims. Because you can't have a situation where the claims are higher than the premium. So we have to do our best to predict what will be the claims next year and then set the premiums.
A brief question and response from you.
Yeah.
Is it possible for a private-public partnership to be formed just for as a cohort of those who would say, I'm willing to accept less than what I would get from the private sector, but still something slightly above what the public sector is able to provide?
There's no doubt, and I think we've been calling for those kinds of ideas for years. Some experiments have been tried with some success, some less successful. Unfortunately, there's a lot of ideology in this debate. There are people who believe that there should be no such partnerships. I believe that they could work extremely well.
Well, I think, there are many communities that deserve that.
Correct.
Right,
yeah.
that probably would be willing to fund to some extent,
yes,
but do not want the
bells and
the
whistles.
Rolls Royce of private healthcare.
You see that in education, Tim, right? You get the very smart, fancy private schools, and you get the Kuros and those kinds, which are, very good, but nothing fancy and much lower cost.
Well, discussions around healthcare continue. For now, we just wanted to focus on the increases for next year. And we will invite you. I hope you will be able to come. So we look at the National Health Insurance Plan and other creative solutions, if we can, that can help reduce the costs and provide more access to healthcare for many more of fellow South Africans.
Thank you very much.
Thanks very much, Doctor.
Thank you for having me.
And that's the Discovery Health CEO, Dr. Jonathan Broomberg, talking to us here on our program.